Hello.
Hello.
Hi. Sorry, had a minor technical difficulty here, letting just you guys in, but we're good now. Raring to go?
Yeah. Um, Ariana, I created a notes document and happy to take notes today if you want to drive the slides.
Okay.
All right.
It's 12 o'clock. I'm gonna let everybody in.
Okay.
It all. We'll have I would probably can give people a couple of minutes beyond 12, just to get started, and then because people will continue to arrive. Waiting in lobby, what? I don't understand.
Like supervision that we're supposed to do.
Oh, here we
I'm
go.
taking this for you too, because I want us to.
Rick, are you able to mute folks?
Yes. Um, Ariana or Kristen, are you able to emit people from your screen?
Mm-hmm.
Okay, so once I start presenting, if there's other people arriving, if you could just let them in.
Okay.
Thanks. Oh, that's no good.
Rick, let me know whenever you're ready for me to get started. I know we're sort of getting the logistics and folks let into the room still.
Yeah, I think we're pretty good though. I think we can start.
Okay, excellent. Well, hello, everyone. I will be your facilitator for today. Thank you for joining today's meeting. I am Jess Key. I am the relatively new Assistant Commissioner of Workforce for the Office of the Post-Secondary Commissioner, and happy to be here today as guest facilitator for the Health and Human Services Workforce Planning Stakeholder Update Meeting. As you are aware, in 2022, the Executive Office of Health and Human Services, the Department of Labor and Training, and the Office of the Post-Secondary Commissioner initiated a collaborative interagency and public-private planning process to tackle Rhode Island's health and human services workforce challenges. This initiative is expanded to engage over 600 stakeholders from more than 200 partner organizations, leading to significant progress over the last 2 years. For those joining us for the first time, here is a brief overview of the initiative. Over the past 2.5 years, our partners combined their expertise with available data to develop a comprehensive plan that outlines workforce challenges, progress made over the past 2 years, and recommendations including both short and long-term strategies aimed at attracting, training, and retaining Rhode Island's future healthcare workforce. To coordinate the various components and individuals working on interconnected projects, we've established quarterly stakeholder update meetings to share information and progress. Today's agenda includes updates on several health workforce initiatives generated by this statewide planning process. Specifically, we will spotlight the ladders to licensure grantees, the statewide community health worker roadmap, and a partnership between the Community College of Rhode Island College, and Care New England to integrate behavioral health training and certified nursing assistant CNA training. For those who have attended previous meetings, you know we move through updates swiftly to cover as much ground as possible. To maintain this pace, we encourage you to submit comments and questions via the chat function. Our team will monitor the chat and ensure all inquiries are addressed either during the meeting or afterward as a follow-up. Thank you once again for your participation and commitment to advancing Rhode Island's health and human services workforce. And we will go ahead and start with an update on the health workforce planning report and recommendations. Rick is going to share some highlights and let you know how you can access this report after the meeting. I'll go ahead and hand it off to Rick Brooks.
Thank you. Welcome, everybody. Ariane, I think you can jump down a slide or two. So thank you again. As just said, we're going to talk a little bit first about the state's current healthcare system planning initiative. This is broader than workforce development, but it incorporates workforce, and there are some very important workforce components that I'm going to share with you this afternoon. For little background, the governor issued an executive order almost a year ago now in February of 2024 to bring together the leadership of all the health-related state agencies, as well as the Department of Labor and Training and the Office of the Post-Secondary Commissioner, to embark on a planning process that would develop both short and long-term strategies to improve the quality, affordability, and equity of our state's healthcare system. To do that, in addition to convening this cabinet, the cabinet in turn and the executive order also called for creating an advisory council that now supports the cabinet and advises the council. And the council in turn undertook to take on conduct key informant interviews, have lots of public meetings. Work groups were formed to identify the challenges as well as the opportunities in reshaping and improving our healthcare system. As part of those discussions, not surprisingly, workforce issues emerged as a major challenge in all the work that health and human services providers are trying to do to meet the needs of Rhode Islanders. So as the planning process moved forward and the stakeholder process moved forward, a number of separate work groups were formed. There were 5 sector-specific work groups, one focused on hospitals, one on primary care, behavioral health, long-term care, and health-related social needs. And then in addition, several cross-cutting themes were identified, including data issues, data needs, value-based payment and payment models in general, health information systems, and also workforce. So each of those cross-cutting themes, as well as the 5 healthcare sectors, are all now being incorporated into a healthcare system planning report that has been submitted to the governor just in the past few weeks and will very shortly, any day I expect, be posted publicly for all of you to see. It's a very extensive report. It's more than 300 pages. Each of those sectors and cross-cutting areas that I mentioned has a chapter that contains a lot of information about the challenges. It also includes data. It also includes recommendations. That 300 plus page report is also being distilled into a 50 or so page executive summary. That executive summary will synthesize in particular the recommendations from each of those sectors. And one of those sections of the report and of the executive summary is focused exclusively on workforce recommendations, and I want to share those with you and tell you a little bit about where they come from. We've had a bit of a head start in the healthcare workforce planning world. We've been meeting with many of you for more than 2 years. And out of that, we have come to develop a pretty comprehensive set of challenges and strategies. And those are what have informed the recommendations for the cabinet report. I want to note that in general, those recommendations, and I'm going to go through them briefly, are not specific to a single sector. They are cross-cutting workforce recommendations. When you have a chance to look at the report, you may see other workforce recommendations that pertain, for instance, just to primary care. So the workforce recommendations are cross-cutting. They're also supported by data and evidence and input from stakeholders, and you'll see references to all of that in the full report. They include both short-term and longer-term initiatives, and they include both policy and budgetary initiatives. We know that we're in a tight budget year right now, but we also know that we need to have a vision and a roadmap for for longer term strategies that may cost money. And even if we're not able to fully fund every initiative in the short term, we want to keep those on the map. And last but not least, the recommendations in the workforce section of the Healthcare System Planning Cabinet report maintain the public and private sector collaboration that we've done throughout the last 2.5 years. And you'll recognize those recommendations that really call upon that kind of collaboration. While we won't have time for discussion today, we do want to hear your thoughts as we go through this. So please do drop any comments into the chat, and I assure you they will get full attention. Okay, so let me just quickly, relatively quickly go through the recommendations that are in the Healthcare System Planning Cabinet report specific to workforce. They're in 4 separate buckets of categories of recommendations. The first one is focused on improving pipelines into the healthcare workforce, strategies to improve our ability to recruit folks into healthcare jobs. Those include sustaining and expanding the work of caring careers. Some of you have seen presentations about this in the past. If you haven't, you can go to caringcareers.ri.gov, which is a website that provides access to information about jobs and training for healthcare careers. We also are recommending to the cabinet and the governor, or included in the cabinet's report, and recommendations are efforts to expand partnerships with career and technical high schools to align with higher education programs and to meet the needs of healthcare industry providers. And also included is a proposal to, if you could just go back. Yeah. Proposal to identify public funding specifically for healthcare pre-employment trainings, proposals to address the challenge and need for clinical placement sites for our health professional students in higher ed programs to get the clinical experience that they need, and to support clinical placement sites to be able to take in students to get that clinical training before they graduate and before they obtain their full licensure. We've also recommended that the Department of Health's licensure division be fully staffed and funded to provide the support to move folks through the licensure process as expeditiously as possible. And finally, to develop new pathways for foreign trained health professionals to obtain licensure in this country so that they can practice as soon as possible. Okay, next slide. The second category is career pathways. These are strategies that to increase opportunities for people already in the healthcare workforce to advance in their careers. There's 3 recommendations identified here. One is to maintain the state's investment in the new Ladders to Licensure Career Pathways Initiative, which we're going to talk about later in this meeting. The second is to renew the state's contribution to health professional loan repayment program, which we're also going to talk about in this meeting. And the last one is to expand the Rhode Island Promise and Hope Scholarships Program, which provide extraordinary support to recent graduates who go to school full-time at CCRI or Rhode Island College. The proposal is to expand those programs to support working adults, part-time students who aren't right out of high school, or maybe not right out of CCRI going into Rhode Island College, but who would benefit tremendously from supports of the Rhode Island Promise and Hope Scholarship Program. Next slide, please. 2 recommendations in the report related to rates and wages. One is because rates and wages are so closely tied with recruitment and retention, the recommendation is to include a requirement that when reimbursement rates are increased, that a pass-through of those wage increases, of those rate increases, is specified. A specific percentage pass-through is specified to go into wages. And the second is that we continue to monitor the adequacy and parity of the recent rate increases that have gone into effect over the last year or so. Next slide. Thanks. And then there are quite a few recommendations related to data. All of these broadly would fall into the category of improving our collection of workforce data, our sharing of workforce data, and our analysis of workforce data through the Healthcare Workforce Data Dashboard, which we're also going to talk about in a few minutes. Without going through all of these, I'll just say it's about collecting additional data that we don't now collect in our health professional licensing process. There are other opportunities to expand the data collection. I'll give you just one example, asking folks if they intend to be working in 5 years, which would greatly improve our ability to do workforce planning and healthcare system planning. Another recommendation is to look at the possibility for the Department of Labor and Training's wage record collection, that they now collect data from employers, to expand that somewhat to include, for example, job titles or hourly wages, which again, we don't currently have that information, but it would expand our knowledge greatly of the healthcare workforce. We can go on to the next slide. So those are obviously very quickly a summary or overview of our healthcare workforce recommendations. What happens next, both with these recommendations and with the larger healthcare planning system recommendations, is that and there are dozens or maybe even more than 100 different recommendations across the sectors. It will, of course, mean that we need to prioritize, and that will involve stakeholders as well, continued public meetings to determine where to put our initial focus based on the feasibility of accomplishing the different recommendations and the potential impact those recommendations can make. We'd, of course, be looking at the cost of recommendations, identifying agencies and advocates, so that's public sector and private sector, to help drive these recommendations forward and to continue to make forward progress. As I said, we know some of the recommendations are longer term than others, but all of them are on the path that we have identified as critically important for our state's healthcare system and healthcare workforce. Again, if you have comments to put into the chat, please do. We would really appreciate those.
Thank you, Rick. So now we will transition into the next section on Health Workforce Initiative updates. We have Rebecca Vasquez from the Rhode Island Department of Health, who will share an update on the Health Professional Loan Repayment Program.
Not hearing you.
Rebecca, I think you're on mute.
Can you hear me now?
Yes.
Yes, thank you.
Okay, so sorry. I'll speak a little louder. So my name is Rebecca Vasquez. I'm the Chief Program Development in the Office of Primary Care and Rural Health at RIDO. I work closely with the Health Professional Loan Repayment Program, which assists in improving access to primary care, dental, and behavioral health care services in medically underserved areas. This is by addressing the federally designated health professional shortage areas in Rhode Island. The program works to defray educational debt while also recruiting and retaining health professionals by providing awards up to $50,000 in exchange of a 2-year service commitment. Another benefit that I wanted to highlight today is the award actually offers true economic relief under the pay-ahead status, which works by drawing down their monthly qualified payments aligned with the Public Service Loan Forgiveness Program. The program has also proven to retain participants beyond their service commitments, with 91% of recipients in the last decade remaining active and working in Rhode Island. In the last year's cohort in 2024, the program was able to provide $1.6 million in loan repayment to 55 health professionals in the state, making this the largest cohort enrolled in the history of the program. Most importantly, what I'm here to talk to you about today is currently our 2025 Health Professional Repayment application is currently open and accepting online applications through February 28th, 2025. We will be hosting a technical assistance next week, February 5th at noon, for applicants who are interested in learning more about the program, also how to apply, and also it's available for employers who are interested in learning more about their site eligibility requirements. We are also, for next steps, we will be applying for renewal for the loan repayment grant with the Health Resource and Services Administration this year for the 2026 cycle. And that was my update for you today. Thank you.
Mute now.
Rebecca,
Okay.
I was gonna put the link in the chat, but as you guys saw, that didn't work. So anyone else wants to, that would be great.
Yeah, I could
Thanks,
quickly
Ariana.
just,
Send this-
if I could just take 10 seconds, I'm Manny Ortiz from Rado. Yeah, we just learned that the REDCap as a system is down today. And so that will impact folks that are applying today, but we'll just extend that application. So please bear with us as we work with REDCap.
Excellent. Thank you. Okay, next we would like to introduce Barry O'Connor, Wavemaker Fellowship Director for the Rhode Island Commerce Corporation. He is out sick and unable to join us, so apologies. So Rick is going to share a brief update on Wavemaker Fellowship Program on his behalf. Thanks, Rick.
Thank you. So many of you may have heard of the Wavemaker program. We wanted to feature this today because, like the Health Professional Loan Repayment Program, the application period is now open. The Wavemaker program, for those of you who are not familiar with it, it's also a strategy to reduce higher education debt. Quite a bit different from the Health Professional Loan Repayment program that you just heard about. The amounts are significantly lower, but there are also fewer restrictions than the Health Professional Loan Repayment program. Pretty much employment in any healthcare setting is eligible for the Wavemaker program. The program was started in 2016. Its purpose was to initially recruit and retain recent graduates to work in Rhode Island in STEM occupations. It was subsequently expanded to include healthcare and most recently education. The program offers tax credits. It's a different way of offsetting student debt. Individuals can apply now, and if they're accepted, they become eligible for up to $1,000 per year for an associate degree college debt, $2,000 a year bachelor's degree, and $6,000 a year master's degree, and for up to 4 consecutive years where funding is available. I will just mention they also have a cohort model, so folks who are in this program are also brought together for other professional development and networking opportunities. You can go to the next slide, please. Okay. You can go to the next slide again. So again, the application period is open now. Applications can be submitted until March 5th, so about 5 or 6 weeks. Strongly encourage you to do this. If you yourself have higher education debt, or if you're an employer and you have staff or coworkers who are in that situation and have higher education debt, it doesn't have to be from a Rhode Island school. It does not have to be your first job after graduating. So check out Wavemaker. I don't for some reason see the link on this slide, even though it's on the one that I'm looking at. So perhaps Ariana, you can put the link to the Wavemaker program in the chat. And that's the update on Wavemaker. Again, please feel free to put questions in the chat as well. I guess I'm up again, so I will we can forego the the introductions. I'd like to share with you a brief update on the healthcare workforce data dashboard. Again, many of you are familiar with this, but for those of you who are not, the Health Workforce Data Dashboard is a publicly available workforce data tool. It's on the EOHHS website. The address that is there on your screen. And it is a way to learn quite a bit about the licensed health professional workforce in Rhode Island. This was created almost 2 years ago. We have brought more than 20 different, maybe a dozen different health professions into the dashboard at this point. There are others in the works. We now have almost all the nursing occupations, behavioral health occupations, oral health occupations. We have physician assistants. Oops. Okay, thank you. We also have it has quite a bit of capacity. If you look at this graphic here, it's just a screenshot from the dashboard, but across the top, you'll see some of the occupations, and down the side, you can see some of the capacity. So we can look at licensed healthcare workers by whether or not they're employed. We can look at them by earnings, by race and ethnicity, age, gender, etc. And then there's additional filters to look at those by the school they graduated from or the type of healthcare setting that they work in. So it's quite robust. We can now go to the next slide. And there's more to come. So in the next week or two, we do expect to have published. It's just being reviewed now by the data stewards. But we do expect in the next week or two to be publishing the newest version of the dashboard, which will include physician data for the first time. It will also include data on psychologists, pharmacists and pharmacy techs, certified midwives and professional midwives. It will also have some additional analytical tools. It will enable users to do an analysis of advanced practice RNs by specialties. And it will soon include another tool that will have an analysis of annual inflow and outflow of licensed occupations per year so that we can see the trends and where we are gaining people in a licensed category and where we may be losing folks in a licensed category. Over the next year, and I don't know yet how long this will take, we do intend to bring additional licensee data into the dashboard as well. Of greatest interest, I think, is probably the physician specialty data, which is still being improved so that it's useful to folks to search. So that will eventually be brought into the dashboard, as well as several other technical and allied health occupations that are licensed by the Department of Health. We are also exploring the possibility of bringing non-licensed folks, data about non-licensed folks into the dashboard, but data about non-licensed workers is much more limited. We do have some information about individuals who are certified by the Rhode Island Certification Board. Those would be occupations like peer recovery specialists and community health workers. So we are exploring opportunities to bring those certified folks into the dashboard as well. And I'll just again go to this question and encourage you to share other types of data questions or data categories that you think would be helpful in your role as an educator, as an employer, as a policymaker. What would help you and your organization do better workforce planning? Okay, thank you.
Excellent. Next, Kristen and Lahoulier, apologies if I mispronounced your last name, Kristen, from EOHHS team will introduce the Ladders to Licensure overview. Welcome, Kristen.
Thanks, Jess. We can go to the next slide, Ariana, thank you. So I know many of you know that last year in 2024, There was a law that was established to fund a multi-employer public-private partnership to provide opportunities for healthcare paraprofessionals to pursue higher education degrees and health professional licensure. That initiative has been affectionately coined Ladders to Licensure, and the goal of the initiative is really around supporting working adults to obtain higher health professional, higher education degrees that lead to licensure. And we're hoping that it's a transformational initiative, that it will really build partnerships and continue to build partnerships, building on what may or may not have already been being developed in the state, and also lead to some changes in how we think about HR and higher ed policies and investments that really support working adults to be able to do this and remove barriers and create more accessible career ladders to higher levels of health professional licensure. Another major goal is increasing the number and diversity of health licensed professionals as well. So we're really excited today to introduce the grantees. The initial grant period is a 6-month grant period. This is intended to be a multi-year initiative. In this very first phase, there's kind of 2 pieces. One is a planning period, a learning collaborative and planning period for doing design work as partnerships and also learning from each other as peers. And then also there is some built-in tuition support as well for individuals that are paraprofessionals that are in the process right now of pursuing higher education degrees towards health professional licensure. So with that, I'd like to introduce our awardees, starting with there's 3 of them. Can you go back 1 second, Ariel? I'll say the names of all 3 and then we'll go through them. The first one is called Rise to Registered Nurse, and that's CCRI and a myriad of employer partners, which they'll introduce themselves in a minute. We also have a partnership that's awardee, that's Rhode Island College, and some partners around clinical career ladders to licensure in behavioral health. And then we have another behavioral health career ladders program with Williams James College and some employer partners. So with that, I'll introduce CCRI and turn it over to Doreen Maroney.
Thanks, Kristen. Hi, everyone. I'm Doreen Maroney, Director of Industry Partnerships at the Community College of Rhode Island. I'm also the project director on our collaboration with Brown University Health and Care New England on the Ladders to Licensure grant initiative. So if you've been looking at the health workforce data dashboard, you probably already know that that very few CNAs per year on average advance to RN. Actually, fewer of them advance to RN than leave the healthcare profession altogether. So our initiative, which we're calling Rise to RN, looks to improve that rate of advancement for CNAs interested in a career in nursing. Rise to RN offers flexible schedules with day, evening, weekend, and online options, and allows students to continue working while advancing their careers. Our program is designed to meet the growing demand for skilled nurses in Rhode Island by offering comprehensive support services like tutoring, financial aid, career navigation, and basic needs assistance, so that these CNAs can feel secure that they're continuing to work while they're working on their degree. As we speak, our employer partners are recruiting a cohort of 20 CNAs for this opportunity, and they'll come from Kent Hospital, Newport Hospital, Rhode Island Hospital, and the Miriam Hospital. Starting in March, we'll be offering them a preparatory anatomy and physiology readiness program, followed by prerequisite courses in biology, English, and psychology. Students will then enter the associate degree in nursing program in September and hopefully complete their coursework by December 2026. To ensure retention and successful outcomes, CCRI is planning to provide comprehensive student support. First, our adult education team will embed adult learning facilitators into our preparatory courses to provide ESL support, math and English remediation support, and HESI 2 test preparation. Students will also have access to all of CCRI's services that are available.
Oh, thank you. Oh, you can come in. I'm
Oops.
listening and multitasking.
So CCRI services, including the Benefits Hub, the Learning Commons, and tutoring services. And thank you for your time. If you have any questions, feel free to put it in the chat or send me an email.
Thank you, Doreen. Next, I'd like to introduce Kyle Penrod from the Institute for Education and Healthcare at Rhode Island College.
Thank you so much. Good afternoon, everyone. And thanks to the executive office for being, so innovative in this project. I think that, our partnership for, clinical career ladders and licensure has the potential to really move the needle with your support. So thank you there. On the screen, you just see the myriad of partners on this project, including.
It's like 400.
Sorry. All right. Looks like everyone is muted. So our employer partners here are Child and Family, Community Care Alliance, Family Service of Rhode Island, the DCYF, TIDES, and then the academic backbone is the Master's in Social Work program and the Clinical Mental Health Counseling programs at Rhode Island College. And we are collaborating in essence, to meet the urgent need for licensed behavioral health clinicians across the state who are both based in the community, but also are reflective of the communities that they serve. And so, this group certainly is privy to the challenges that the behavioral health field is grappling with, right? Many incumbent staff in community-based organizations, they face barriers to advancing their careers. There's fiscal challenges, work and family obligations. There's some systemic disparities that contribute to the lack of access. And then there's also some rigidity around academic programs, specifically at the graduate level, because you have accreditation standards to do. And so we're thinking about ways in which we can innovate the modality, and the way that the courses are delivered, but then also how do you better support working adults? And so this initiative, it aims to just better align the higher education with community-based partners to eliminate some of these barriers. And our approach is really during the 6-month planning phase is to design an innovative, accessible pathway for staff to pursue advanced education and licensure. In an effort to ensure that clinicians can better reflect the identities and the needs of the communities that they do serve. So our plan really includes key innovations. We will create a pathway to support up to 16 graduate students in the MSW and CMHC programs, and up to 25 bachelor level case managers interested in advancing their careers. With the top priority really being diversity. We want the workforce to recruit BIPOC, bilingual, and culturally responsive professionals. And part of this is by reducing financial barriers, offering flexible learning options, and then leveraging kind of our partnerships with community health organizations. I think at the crux of this issue is that there are perverse incentives for most folks, right? The cost of education is high, and then on the other side, so during that process of pursuing your degree, you're deferring wages, and then you graduate and matriculate to a space that, at least at the beginning of your career, does not have the income and salary that I think that truly is reflective of the value of the work that it is providing. And so this partnership is aiming to look at ways in which we can both decrease the cost of that tuition. The college is committed to exploring the ROI of what a 10% tuition reduction could look like. And through this planning phase, we'll explore ways to both increase the academic infrastructure of these programs so that they can maybe bring in larger and larger cohorts. But then also these cohorts will be saddled with less debt moving forward. So with that, I would just like to thank the leadership of the executive office and hope that we can move the needle on this project. We look forward to talking a lot more about this project moving forward.
Thank you, Kyle. And I just wanted to note for folks that there's a lot of great questions that are coming up in the chat. Rick is making an attempt to answer them. So if you have questions as you continue to hear about these grantees, feel free to drop them in the chat. And then we do have a few minutes at the very end if we can to try to address other questions that are popping up in the chat as well. And also questions that folks want to ask. So our last grantee is a partnership with that's being led by William James College, and I'm going to introduce Daniel Tierney to overview that.
Hi, good afternoon, folks, and thank you for this time. And I just want to echo Kyle and others' appreciation for Rick and Director Brooks and his team and everyone else at RIOHHS for the work and for sponsoring this incredible program. So we are William James College. We are a school of behavioral health for folks who don't know in Newton, Massachusetts. We're partnering with the organizations that you see here to stand up a cohort of students, of licensed clinical mental health counseling students, but I think even more importantly for this initiative, look at some of the pain points and challenges that folks have in their careers as clinical mental health counselors. And so you can go to the next slide, please. So again, the challenge is well known, and that's something I'm going to need to dive into, that we're all recognizing that we're in a mental health challenge and crisis now. That's leading to longer wait times and clinicians not having perhaps the cultural competencies to meet their patients where they are. And so, as I mentioned, we're not only looking at standing up a cohort of students, but also looking at some of those systemic problems. And the first, of course, is just mapping out the career ladder of clinical mental health counselors, how they come into the profession, and then understanding some of the acute pain points that those counselors may have in both their educational journey, but also when they go to practice. You can go to the next slide. So we have some emerging hypotheses in our partnership that we begun to discuss, and certainly there's no question that financial barriers are a challenge, both just from salary, but also from the educational tuition burden that folks may face. And so we at William James College are also committed to making that burden as accessible and lowering that burden as much as we possibly can. But we also believe that tuition incentives alone are not going to be enough to solve this problem. We know that folks need to have the right kind of training to meet their patients where they are. And they also have to have the kind of professional identity reinforced in their career later on so that they don't attrit and they don't seek careers that might be slightly less challenging, but also less fulfilling, right? So that's sort of the work that we have to do, is to look at those pain points and overlay the solutions where we find them. And again, we are excited to, I don't want to give another plug for the data dashboard, but it is an incredible tool. And we're excited to leverage that and other resources in the months to come as we build out our career ladder. And we're grateful for your partnership.
Thank you, Daniel. Jess, I'll turn it back to you.
Excellent. Thank you. Thank you, Doreen, Kyle, and Daniel. Now, Tanya Glanz from Rick and Anna Souza from CCRI will share an overview of the CNA BH Certification Training Partnership.
Thanks so much. Hello, everyone. I'm Tanya Glanz, and I have the pleasure of presenting the materials that my colleague Anna Souza and I put together for this presentation. Anna is on by phone, but moving spaces right now and having some internet issues. Our program on the initial slide, I'm not sure if you caught it, it really was a representation of what happens when funding partners, education support partners, employer partners come together and really vision what is needed in workforce and how collaboration can make that possible. So you can see all of the wonderful organizations that were part of it. Predominantly, the project focused on training incumbent staff and newly recruited staff for Care New England, and Rhode Island College and CCRI were the training partners. If you could just go back to the previous slide quickly. One of the things that made this possible, initially, we were visioning it that the behavioral health piece would happen and then the CNA piece would happen, but we quickly discovered that it was a very complex process related to the recruitment, preparation, and then also the matriculation of students. And what we found to be really effective and looking back are really grateful for was the power that came from these people, these amazing women that I got to work with, coming together on a weekly basis to touch base and make sure that we were all equally informed, and working directly with the students so that if a student contacted one of us, we were all informed and that student felt really supported by the three organizations. And so these are members of the team who really made this project, on the practice end of things, a great success. You can go ahead to the next slide. Within the Care New England system, they were seeking to create a career ladder for staff who were stuck at more entry-level positions, whether it was food service, doing basic client care. They wanted them to be able to meet a need that was opening up in the organization, and that was a mental health worker. Those positions required people to be licensed as CNAs, and they also wanted them to have behavioral health training. We've been really fortunate for the last, I want to say 5 years, we've received a great deal of support from EOHHS and DLT around our 30-hour paraprofessional behavioral health certificate, which has been extensively utilized in long-term care. It was the curriculum to really help orient this workforce and help them to bridge the healthcare piece with the behavioral health piece. And so we utilized a multi-stakeholder strategy to recruit, ready the staff who came with different strengths and challenges, and then to support them through the training. And the project itself lasted over 2 years. We learned a great deal, and I'll share some of those lessons learned in the last slide. But what we learned as we went through year one really allowed us to make modifications to the process that really enhanced our success in year two. Community College of Rhode Island was our CNA partner, and that's Anna Souza, really was a superhero in that regard, keeping things going and really helping the students to be successful. At the Rhode Island College end, it was the Institute for Education and Healthcare that provided the behavioral health training. The behavioral health training was provided entirely online. And then what we did is we worked collaboratively to really upskill. So for incumbent staff, working to help them navigate the Care New England system to identify open positions. Many of them were looking at the mental health worker, but some of them were also looking at other parts of the organization. And we quickly discovered that it wasn't just the incumbent staff upskilling that was needed, but that Care New England also needed recruitment of new hires who would be able to come in and fulfill these needs. And so together we worked after people were trained to really get them into jobs that included a step up in salary, responsibility, and also help to optimize the organization's ability to serve a diverse community. You can go to the next slide. This is just a quick snapshot of what we accomplished over the last 2 years. In the first year, we had folks go through the behavioral health training. We too used a cohort model, and we have found great efficacy in that approach. The behavioral health training is a very different delivery of information and consumption of information than the CNA training. And after the first year, we decided to flip-flop it and to lead with the CNA training and end with the behavioral health training. And we definitely saw increased retention. Our overall goal over the 2 years was to recruit a total of 70 students. Initially, they were all going to be incumbent students. That changed to be a mix of incumbent and new hires. In the end, in year one, we did not recruit 40. We ended up recruiting 25, and a lot of that was because we had not built in additional supports for CLEP assessment and to provide additional support for students as they were going on. When we went into year two, our goal recruitment was 30. We ended up recruiting 32 people, and we had all of that pre-support stuff planned. And in many ways, my colleagues from Care New England and CCRI jumped in year one and provided those supports without any kind of additional funding being available. And it really helped us to understand the needs of this workforce better. Right now, you can see we just actually had a great graduation ceremony for the two cohorts. Unfortunately, it happened on the one true snow day in Rhode Island this year, but we were really appreciative of Rick turning out and addressing the group, and we'll share some pictures in a second. We have noticed with the CNA training going first, followed by behavioral health, we're having great success with people in the cohorts completing the temporary license. And in the first cohort, we had 100% moving to the full license, and we're just waiting because our second cohort for year 2 is in the process of taking the exam, but we have high expectations about their success in achieving the full licensure. And then we should have some updated information about their job placements. You can go to the next slide. This last slide is something that I think those of us who are in workforce development need to be reminded of. We need to celebrate the successes, the joy and sense of accomplishment that our graduates had when they attended the graduation ceremony and brought their families and were addressed by leaders in Rhode Island. You can't even measure it. And so just to have the numbers of, oh, this many people went through and we had 88% retention this year, it's not enough to really capture it, and it doesn't respect the contributions and the sacrifices made by people who become students in our programs and then go on to do amazing things in our workforce. And so I really want to encourage all of us to think about the importance of this. And so in the first corner here, this is our first year graduation. We had an address from one of the graduates who's a mental health worker at Butler. Here we were, it was in July, no snow, and we were joined by a number of leaders in Rhode Island. And then down on the bottom was this year's cohort graduation, which the grant ended in the end of December. So we had to have a December graduation. And so I was really surprised, despite the horrible weather, by how many people showed up. And this is part of the class taking a picture. And here you can see people listening to Rick talking about the importance of workforce development and what's been happening with our faux fireplace that did keep people warm during that snowstorm. You can go to the last slide, please. When Anna and I were putting this together, it harkened back to many conversations that we had with Sandra Victorino, formerly the head of Care New England's workforce development, and her counterpart, Mushi Kalixi, who played critical roles in supporting the staff. And throughout the process, there were some themes that continued to come up that really helped us to contextualize and improve the process. And what we learned was that assessment, support, unity, celebration, and connection are critical to the success not only of our own workforce development projects, but to workforce development projects in general. And we tried to have a continuous process of learning and modifying as we went along. I mentioned how we decided to flip-flop when we offered which class, adding pre-testing with the support.
Tonya?
Yep.
Really quickly, just in the interest of time, I was going to just ask if we can sort of wrap up relatively quickly. We have about 3 minutes. We're over just a bit, and I just want to make sure that we have time for the last speaker. Apologies.
Yep, no problem, Jess. I was actually just wrapping up. I'm known to be a little bit of a talker by the people
I am too.
who know
Thank
me,
you.
so thank you. And so how we supported folks extended beyond the training, the unity, the fact that we learned that we had to come together on a weekly basis, and then celebrating and then connecting. The fact that as we're training, we need to be informed by our employer systems and we need to share that information back with them. We do have the dashboard that is a critical resource. And we also have learned that you need to have these multi-interdisciplinary partnerships in order to really meet the needs of this diverse workforce and the employer partners. And Rhode Island College and CCRI, we're grateful to have been a part of this. Thanks so much.
Excellent. Thank you, Tanya. I appreciate you. I would like to now introduce Emily Garthy, COO of the Rhode Island Parent Information Network, and Swanette Salazar, Lead Community Health Worker for the First Connections Program at Family Services of Rhode Island, to give an overview of the recently developed Community Health Worker Roadmap. And just so everyone knows, if we do run out of time, we won't hold a period for questions, but you can send any questions in the chat or via email to be followed up on separately.
All right, thank you so much for the introduction. I'm here with my colleague in this work, Swanette Salazar. I'll hand it over to you to get us started, and I'll be with you in a little bit.
Hi, everyone. My name is Swanette. Welcome. Happy to be here. We can go over to the next slide. All right. So who are community health workers? We're essential and trusted figures in the community. We help guide individuals in understanding and navigating complex information, systems, and just life challenges. As pivotal members of the community, we help expand the traditional healthcare workforce and prioritize whole person health. And as trusted individuals in the community, we actively are working on rebuilding the historical mistrust that some communities have with the medical field and other professionals, many times advocating for our communities and help preventing, any further trauma to individuals and separations of families. Not only do we excel in bridging these gaps in the healthcare delivery and support services, but many times we bring insightful context to situations that can help care teams properly navigate challenges and successfully achieve their shared objectives for the individuals we serve. So, for example, a diabetic patient frequently visits the emergency room, not following their care plan. The doctor sometimes can use a scare tactic like mine did when they told me I was pre-diabetic. You need to eat better and stuff, right, to see if that would get the person back on their care plan. CHW met with that individual afterwards to figure out that the refrigerator was actually broken and they were using neighbors to house their medication. So the CHW was able to work with that person, help them follow with their landlord, understand their rights, and within a week was able to secure them a new refrigerator so they can get back on their medical care plan. So that's just one example of something that, and one way that we can touch and really help support people. We also regularly conduct screenings like PHQ-9s, ASQs, and can even do that at the luxury of someone's home. We can be found across various settings, clinical, community, and even others are working independently for themselves. And we can be found in many interdisciplinary teams and integrated behavioral health teams throughout the state. Some of us are in women and infants, at nonprofits. We're working with MCOs to address other health needs, and others are involved in initiatives like, for example, the DOSE program, which if you don't know, look into it, which is great because we have CHWs working with clinical partners and legal professionals in the practice, just to share some examples. Next slide, please. So the strategy team, we have a long history in Rhode Island of supporting CHWs, and many of you know our positions are grant funded, and this reliance creates sustainability challenges for employers and raises questions about career development for some of us CHWs. So in 2023, Rhode Island Department of Health established a strategy team to unite CHWs, employer, policymakers, advocates to discuss all things CHWs. So this group focuses on key topics like workforce development, advocacy efforts, sustainability, and interagency collaboration. On average, we have about 60 to 80 individuals that participate in these monthly meetings, now bi-monthly, to share updates, address challenges, and discuss other efforts. Next slide, please.
Yes, so we wanted to extend an invitation to you all to join us at the next strategy team meeting. As Juanette mentioned, we meet bi-monthly. Our next event will be held on February 5th. And if you scan that QR code, you'll be able to see our full meeting schedule for the year. So please reach out. We're looking for community health workers from your organization, as well as allies, partners, and other organizations. Next slide, please. Back in 2023, our friends at Department of Health worked with We in the World to create a roadmap for Rhode Island community health workers. And through that work, implementation teams have been created. So my friend Swanette leads the CHW role, agency, and leadership. I facilitate the workforce development for supervisors and CHWs. We have a payment and sustainability group, as well as coordinating infrastructures and community coordination. So if you'd like to be a part of any of these groups, please reach out to these individuals here and we'll get you connected. Next slide, please. So this is our last Community Health Worker Workforce Development Roadmap. There's a lot on this slide here, but I guess I just want to point out the highlights. Together, our work group has worked on some goals to train CHWs to develop and deliver comprehensive supports to communities, train CHW leaders to support change in communities, make sure that there's a certification and training pathway for CHW supervisors and sites to support CHW's role and well-being, and also to build a CHW payment system that's built on credentialing for supervisors and sites for CHWs. So far, we've really built a lot of partnerships. You'll see that there's 36 members of this group, and I'll tell you, it's an amazing community building between allies, community health workers, and partner organizations. We are working on a working document, and that's what that QR code is there. If you need access, please just email me. But we're working on a document where employers, CHWs can have resources at their fingertips. So we'll continue to work with our stakeholders to work on analyzing our data. Next slide, if we have time.
It'll be quick. Send your CHWs and all those that fall under the umbrella to our meetings. We can help them out. It's a safe space for us to learn with each other. We invite national members connected with other CHWs and opportunities. We're planning the CHW conference this year. We hope to see you there in June. And this is just a leadership group that really supports CHWs, and we bring those challenges back to the strategy team to help brainstorm some ideas. So we hope to see you guys in your future. And yeah, if you want to, this conversation was really great, so I'm really excited to see what happens because CHWs are really trying to figure out what the pathway is to advance in their career. So thank you for inviting us to this conversation.
Mm-hmm. And if you scan that QR code, you'll get this great document that has all links to support your community health workers and also get connected to Swanette and I. So feel free to download your guide to stay connected. Thank you.
Excellent. Thank you both so much. We will go ahead and wrap. As mentioned, if there are any questions out of any of today's discussion, please send those via email to Rick Brooks and his team. And we will see everyone for the next online stakeholder meeting, which will be Monday, April 21st from 12 to 1 p.m. Thank you for your time.
Thanks, everybody. Thank you, Jess.
Of course.